Before we get started in this episode, a quick announcement. As you know, I'm very passionate about acceptance and commitment therapy, and I also run a busy practice in Canberra. We're currently looking for psychologists who are registered in Australia to join our team, who are also passionate about learning about ACT. We provide supervision on a group and individual basis and training around ACT. So if this is you, if you're interested, please express your interest at strategicpsychology.com.au/careers. Look forward to hearing from you. And now back to this episode.
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking. Yeah, better thinking. Time to tune in. Let's go.
Welcome back to Better Thinking. My name's Nesh Nikolic, and my guest today is Dr Alice Shires, who is a clinical psychologist, senior lecturer, and psychology clinic director at UTS. Alice heads up the UTS Mindfulness Integrated Therapies Research Clinic, and prior to this position was the director of the psychology clinic at UNSW for 12 years. Alice has worked as clinic manager at the University of Sydney and consultant clinical psychologist in acute and specialist mental health services in the UK. Alice has been involved in the teaching, training and supervision of clinical psychologists and their field supervisors for many years. Alice has been teaching and supervising cognitive behavioral therapies over the last 20 years. She has developed expertise in mindfulness and its integration into cognitive and behavioral therapies, and has assisted in the development of accredited training in mindfulness integrated CBT. Alice continues to teach advanced mindfulness training for mental health professionals via the MICBT Institute and is involved in supervision of research in MICBT psychological therapies. Currently, Alice is undertaking research projects investigating the possible effects of mindfulness training on anger, grief, and chronic pain. Alice also has been the chair of the New South Wales section of the APS Clinical College from 2006 to 2010 and a university representative on the Psychology Advisory Committee for the New South Wales Department of Health. She was a founding board member of the Australian Clinical Psychology Association from 2009 to 2012 and is currently the New South Wales section chair. Today's conversation with Dr. Shires is fascinating, as you can see her passion of mindfulness oozing out throughout our interview and conversation, and some really enjoyable insights to listen to. So I know this is one that many of us are going to enjoy, whether you're a clinician or someone who is fascinated about the ins and outs of psychology. So it's one to listen to. Hope you enjoy. Alice, a big thank you for coming onto the show today. I'm really excited to explore this topic of mindfulness and look at where it goes. I know that you've got an extensive amount of experience in looking at mindfulness, whether it more broadly or in the MICBT world, and some of your recent or current research looking at how mindfulness and training can apply to whether it's anger, grief, chronic pain, and I'm assuming other spaces as well. So, thank you for coming on.
It's an absolute pleasure. Looking forward to it.
Tell me a little bit about. I like to always understand from my guests where do they come from? How do they fall into the space of mindfulness? I know this is a big passion of yours. How did you stumble across it?
Well, I trained in CBT. I'm a clinical psychologist, and I undertook my training in England, in the UK, and trained predominantly in CBT, although some psychodynamic approaches and some systemic approaches. But I felt quite frustrated with CBT in its rather rigid form, as perhaps it was taught. I think it might have become more flexible over the years and incorporated elements from things like ACT and mindfulness. So it's, there's some interesting spaces, but in those days it was somewhat rigid. And my interest started actually when I went to a conference in the UK many years ago and was in a workshop which was very tedious, and so changed over in the coffee break and ended up coming into a workshop given by Stephen Hayes on ACT. And it kind of blew my mind a bit, really, because I thought, what have I walked into? It was experiential, and it was so different to CBT. And I thought, wow, this has got some real power. I love this, So I became very interested in ACT. The theoretical element to it was a little bit hard to chew on when the first book, but it was really interesting to me. And so I thought, now we're beginning to break into some other areas that will be an alternative to the standard CBT. And so I was working with that for quite a long time. And then I came across Bruno Cahin, my colleague of 15 years or more, I think. And he was presenting on MICBT, which is Mindfulness Integrated Cognitive Behavioral Therapy, for want of a better title. And when he presented that, it made so much sense to me. The model for MICBT covered everything. It was as if it was just explanatory of pretty well all disorders. And MICBT is a transdiagnostic mindfulness approach, and so it made sense that it did that. So all the pieces sort of came together, and from then on in, although I continued to teach CBT, I teach clinical psychology at UTS, and CBT is very much the central focus. But I was very lucky that I was able to actually take on the job of teaching and teaching MICBT within the clinical training program, which has been a delight. And so that was my first foray into it. So it was Stephen Hayes and then Bruno that sort of introduced me to the model. And I've been working now with MICBT for about 15 years, which is time goes by very quickly.
It's interesting to hear your path. I in some sense had something similar as well, where I stumbled across ACT following in many ways a short but passionate love of CBT to start with, and then into ACT. I went to Steve Hayes and others training, and I've met Bruno and been to his courses as well, and it's interesting to hear that this flavor of mindfulness keeps coming back. And I know that there's so much text coming out now that talks about whether it's mindfulness based CBT or whether it's process based CBT. It's not that CBT doesn't have great effect and efficacy. It's just that it seems like many of us are looking for something when we hit that brick wall, when rationality is no longer cutting the mustard, so to speak. So it's lovely to hear from someone like you who's got so much experience, that you've had a similar path as well.
Yeah, no, it's been an interesting journey. And of course, MICBT is only one of many, many mindfulness programs that, and it's kind of described as a second generation mindfulness. If it's in the first sort of generation of MBSR, MBCT were kind of took out some of the aspects of the original Buddhist teaching, and MICBT and some of the other programs kind of brought them back in again. So one of the beauties of it is that, for me, is that it actually does include some of the ethical precepts and some of the components from the original Buddhist wisdom, from which we've kind of stolen their wisdom again, and taken it and used it. But to keep some of those things rather than throw them out. I felt like some programs have really thrown the baby out with the bathwater to some extent and lost some of the power. So I was also really interested in MICBT because it's one of those programs where those things are considered. But of course, it also includes elements, the core, really important elements of the cognitive and behavioral therapies. So it involves quite a lot of exposure work. and it's based on learning theory and reinforcement, and considers those as part of its model, the co-emergent model within MICBT. So it's taking on board and other aspects, including interpersonal aspects, which of course are across all disorders and across all of our problems, our interpersonal issues. We all want to be connected in meaningful ways, whatever the disorder, whatever the stress. And so the interpersonal aspect of it, I think, is really important, as well as ways of implementing the increased wisdom over, but in our lives, using exposure principles. So it brings a lot of the power of CBT, but it has at its core the need for sustained practice. We're using neuroplasticity, and that's very important. There's no magic pill for it. So we're using that, but we're bringing in all of these other elements of wisdom in a kind of package that actually includes all of the key aspects of our human experience, our thoughts, our feelings, our emotions, the sensations that make up those emotions, and the response to those things, or the reactions to those things that form our behaviors. And once we kind of understand that model, if you like, then everything sort of becomes clear a bit. It's a bit like when I first came across sort of schema work, and it, I kind of got that beautiful moment where you realize that once you could locate someone's kind of schema, it explained so much of their behavior. Now I can see why all of this is unfolding. So it's a bit like that. It's a bit like, once we know the components of the human experience, how we take in information, process it, and so on, and we learn that experientially, then of course it gives rise to a tremendous amount of wisdom about the self, and some chance of making change, because we can't change things if we're not aware of it. So it's been a delight to use it. I think but it's not the only method, and there are lots of emerging programs and some really interesting stuff, and so much literature in this area. I was looking this morning, there was a systematic review of meta-analyses, which I thought was amazing. So for those that might not know it, meta-analyses are when you take a whole lot of studies and take all of their data and reanalyze it. But this was a systematic review of all of those meta-analyses. So altogether, it was something like 336 randomized controlled trials looking at 30,000 participants. And so they were looking at the effects of mindfulness across all of these reasonable standard studies. And that's not really been done before. So it does represent a nice collection of the data, and it's interesting. It's a mixed bag, like lots of things in research. They always seem to come out with mixed results. But it does suggest that mindfulness certainly seems to, pretty well across the board, the mindfulness programs seem to be superior to passive controls. So it's better than nothing. It's better than waitlist, which is great. But in some areas, it's coming very strongly as superior to some of the active controls, including things like CBT and so on. Interestingly, in psychiatric disorders, it showed itself to be quite strong in comparison to other treatments. And at follow-up, whereas some of the physical health things like pain and so on, it's really on a par with other treatments. And given that there's a great battle to really come up with some really powerful treatments for pain and health, it's kind of on a par with the state, which is good enough. I mean, it's as good as, and that's perhaps sometimes when we say there's no significant result with a control that's active, actually what that means is it's as good as, and therefore we have some choices as clinicians, whether we use the current evidence-based treatment, or whether we bring some of these other treatments that have some equity in their evidence base. So it's a mixed picture. There's no huge results sort of, but it certainly confirms overall that that these mindfulness programs or mindfulness integrated programs are very, are building a body of evidence. And certainly for the relapse of depression, that's clearly evidenced as more effective than CBT across all of these trials. So we're beginning to see a shape from this huge amount of research that's taken off, in terms of mindfulness and some of the other programs like that include some meditation practice as well. So so it's an interesting field to be in at this point.
It seems like there has always been, in many ways, a mindfulness component, because just to be taking another perspective or to be looking at a different viewpoint requires there to be, a noticer, requires there to be an observer. It's just that now it seems like there's more of an explicit process toward highlighting that observer exists, that there is a potentially value in developing a non-judgmental witness that can observe these things. And if we practice that, we do numerous cycles of that, we become better at diffusing, at separating ourselves from thoughts, or observing feelings so they're not pushing us around as much. And in many ways, it seems to me that traditional CBT has worked on that as well. It just hasn't been explicit. And once we talk about some of these processes a little bit more directly, I think it helps clients to see themselves what they're trying to target. So it's not just one thought against another, which in many ways works. That's probably how I still run 98% of my life. But any time I get stuck, I can go back to the observer. So it's not that, rational and logical minds are not, incredibly helpful. They are, phenomenal. They are probably the best part of the brain.
Well, in a way, CBT, if it's done well, first of all, brings a lens of two thoughts. So thoughts, because we're working with thoughts in CBT and assumptions and so on, it does bring it kind of puts those in the spotlight. And by observing them and noticing that we can change them and we can change our minds over and over again, often clients, after some while of changing their mind and noticing how that affects their feelings and therefore their behavior, then the shortcut becomes more appealing. Do I need to actually go through all of these thoughts and, really look at the evidence for and against in that very traditional way? Actually, maybe now I've done that so many times and proved that I was wrong and that wasn't correct, and that it was, that one becomes almost, one starts to move towards, well, if I see that these thoughts can be changed and that they change with my mood, and that under the light of rationality, they don't seem quite so obvious or clear cut, then as a result of that continuously, we start to, in a way, undermine some of our unhelpful thoughts. And once we do that, the shortcut might be, rather than analyze the thoughts, simply let go of them and not engage with them in the first place. And that becomes much more like mindfulness, which, of course, it's, in most mindfulness programs, the idea is to observe them, but not engage with them, even as they start to pop up. And it's a lovely idea that I put with clients, is, where does a thought come from? When do we know a thought is arisen? And where does it go to? And to actually watch a thought starting to emerge, and then by not engaging in it, it just disappears. So we don't even have to bring the thought to fruition. And then, because then we have to challenge it. And there is an argument that by thinking I'm not stupid, I am, of course, thinking stupid, sure, and therefore, et cetera, et cetera. So better to just bypass it. So in mindfulness, the critical difference is that we're not engaging in any analysis of thoughts at all, but only noticing that the process of thinking is occurring and bringing the attention back to whatever the target is, the breath or the body, in order to learn to disengage. And that probably underlying that neurologically is probably doing some things that affect, for example, the default network, which has now become fairly widely known about, this network in the brain that's in charge of thinking about things that come to our attention in relation to me. So what does that mean to me? It's sometimes referred to as the me network. So what does everything as I see it and hear it mean to me? And of course, that default network is very active in people that are depressed. It's very active in people that are troubled. And it's less active in people that seem to be more content. So although it serves a purpose, like all of those neural, capacities, we need it. It's not that we want to get rid of it, because we need to know what things mean for us, for our survival. But when it's overactive, it becomes continued rumination and worry and so on and so on. And it seems like that network can be inhibited when we do things that are kind of take our mind, so gardening or drawing or wonderful. And then there's that feeling of flow, because we're now inhibiting this network. And of course, that's really what mindfulness is doing. We're learning by not paying attention to the thoughts, bringing back to the sensations being the focus of attention. Then we're starting to learn to inhibit that network and possibly other networks that related to salience and other aspects. But certainly it makes sense that if we can inhibit that network, it's always going to be there for us. We're always going to be able to think, what does that mean to me in relation to my past? Is it dangerous? Is it this? Is it that? But when we practice, you can almost notice this little network. Every thought comes with what does that mean to me? And it's a great rest to be able to shut it down and just experience whatever we're experiencing without it, whether it's the breath, whether it's the body, whether it's in our practice. And perhaps then some of it can be taken out and generalized into our normal lives. And certainly it seems that that's a very important neurological finding. And there's a guy called Norm Farb in the US who's written quite a lot and doing some wonderful neurological work with MRI scans. He's very lucky to have those resources, and does some fantastic imagery research looking at the effects of meditation on this default network and other associated networks, to see how mindfulness is kind of, inhibiting them. We used to think all the research was about whether mindfulness grew your brain almost physically, whether there are areas of the brain that would get bigger. But that's really quite crude in comparison to the networks. And it's not just the activation of networks, it's actually really, perhaps more importantly, the inhibition of neural networks that gives us that sense of flow and release. But it does, like all things that we learn, whether it's the piano or riding a bike, it, of course, unfortunately, requires a ton of practice. And that's, in a way, the focus of the clinician in MICBT is almost exclusively really getting the person to actually practice. And that takes a lot of work.
That's why I think many people who are practicing and they are involved with, whether it be Buddhist principles or, meditation, that do a lot of practice. There's such a rich environment for that repetition to occur. I know for myself, even though I struggled immensely with university because, I was young and I didn't see the value in it. And, I was above it all, of course, when you're young. I recognize that in tutorials in particular, I would hear what one student would say and I would cling to that idea. And I think to myself, my goodness, geez, they're smart. I never thought of that. That's such a brilliant idea. And, I'd keep that, in my back pocket. And it wouldn't even take two more comments, and someone else would say something that was, in my mind, far superior to the first. And so I'd say, oh, that's even better. So I'm going to discard the first one. And you do that for, the duration of the tutorial, and you do that every single week for years. And that was the practice ground of not holding any idea too tightly, and we know that anything that resonates for us, we grab tightly, or that's enjoyable, we grab tightly. And for me, university wasn't just an education ground for understanding and learning about psychology. It was very much about, how do I hold these ideas? Because they were only true, and this is obviously what the scientific method does as well. It's only what's true today, with the evidence that we've got today. And it's such a beautiful way of thinking.
Changing field.
Yeah, it's liberating.
It fits in a way with the notion of mindfulness, leading to a kind of cognitive fluidity.
Yes.
That seems very helpful to people. So rather than having a rigid set of beliefs or goals, there's a loosening that I see with clients that occurs. So there's less of the I, me, I like, I don't like, all of these rigid kind of assumptions. And by a sort of osmotic process, people become just a little bit more fluid about those things, and sometimes really much more fluid about those assumptions. So it's looking at each thing in a more open way without bringing to bear all of the assumptions and rigid beliefs and so on, but looking at things fresh and new and being not sure. And I think that's different to, there's perhaps there's been a kind of wave of this talk of the not knowing approach, and I think it gets sometimes a bit confused with not knowing anything. And of course it's really needs to be thought of as not being 100% sure. We see what we see, but that of course can change with the next piece of information and the next piece of information. So we're continually growing. And you touched on, of course, attachment. Our attachment to things is what causes us a great deal of craving and aversion, happiness and sorrow. And the more attached we are to something, the more likely we can be hurt by it. So people often cling to beliefs that are very attached to their identity. And when that's then threatened in some way, it feels very much like it's threatening me, my sense of self. And that's when people find it very difficult. So a bit more of fluidity would be very useful to all of us. It protects us from these rigid identities that seem to cause a great deal of difficulty. You can almost measure how upset someone's going to be by something depending on how attached they are to that particular thing, and whether it's a self-identity. If I think I'm clever and then someone tells me I'm not, it would be very hurtful because that's part of my identity. Or whether it's someone close to me because they're mine, as opposed to what difference the value of someone who's mine as opposed to someone who's over the other side of the world. They're the same. So this attachment issue is what causes a lot of difficulties and suffering. And that mindfulness approaches also touch on that, a loosening. We're in the Western world, so we're not going to get to enlightenment. There's no way. But even over 10 sessions, we can make a shift or a loosening in our rigidity towards things, and a more open mind, and maybe a shutting down of or an ability to at least inhibit the default network and do less of that me thinking. And what would be interesting is if we didn't do all that me thinking, what does this mean to me? What would we look like? Might we be much more aware of others? Might it be we rather than me? So and that brings in, of course, all of the literature and all of the the renewed interest in Western science of the compassion approaches, and which is wonderful that we're looking at those areas and starting to think about how we can utilize those to mend people, and I'm very interested in some of the work that Christine Neff and others have done in that area as well.
Can you say a little bit about maybe expand a little bit about attachment and clinging in the space of today's very uncertain world? There's propensity to grab onto what is true, or at least cling to feel like you've got security in grabbing something tightly when there's chaos, or at least perceived chaos. Can you talk to us about our complex world? There's lots of uncertainty, and the role of mindfulness in today for our well-being.
Yes, well, there's indeed, and there's a lot to think about, and I'll start from a sort of back end and then work backwards, because I was at a conference recently where there was a Buddhist monk talking about what use mindfulness has in a way in relation to climate disaster, and what he felt was fairly impending troubles ahead, so he wasn't painting an optimistic picture at all, but that what can we do in relation to impending disasters as a human race? What's our role? And he used a nice analogy, because someone had said, isn't it rather selfish to be practicing mindfulness and focusing on oneself in a world that's where it's turning into disaster? Should we be protesting? Should we be this? Should we be that? And yes, we should. We probably. The suggestion was that from a Buddhist perspective, that yes, we can in ways that are thought through. But the analogy was that if you're on this sinking ship, we don't want to be the person that pushes people out of the way to get onto the boat. That may not be the right way, but we also don't want to be the person that's quivering in fear in the corner, and that's not a helpful contribution. So if we can attend to ourselves, our own minds, our own issues, and become more resilient, more robust, all of those things, then we can be the person that perhaps assists those people as the boat's going down. We can assist for people to get into the boats. We can assist the people who are terrified to try and leave the boat, as quickly as possible. And I thought that was a useful analogy. It's really about, there's when things are going to be troubled, or they have been troubled and they continue to be, there is a sort of responsibility to get one's own house in order to be ready to assist others. And it was a nice analogy, and it made it it helped to clarify for me some of the dilemmas, I suppose, about what role we should be playing in these bigger world pictures. But also on sort of working back from that, I'd done some thinking with others also about future disaster, and the need for equanimity, that to develop skills of equanimity, which is to not react to craving or aversion. And that comes into mindfulness programs. You're probably familiar with those words if you've done Bruno's program. That everything we do is a craving. I feel hungry, I crave. I feel a pain in my leg, I move it. That's the response to aversion. But that we can actually temper those, and we can develop skills to be able to respond rather than react to craving and aversion, and make some decisions about craving and aversion. And with that practice, and the practice of the going through the body, exposing to all of the sensations within the body systematically, not reacting to them, whether they're craving or aversion, what we're developing is this strong sense of equanimity, a non-reactivity that comes back to that position of being on the sinking ship and being able to respond in the best way possible to assist others, rather than to be reacting to fear, or to competition and greed and pushing other people out of the way. So equanimity is the kind of underlying skill, and with it, of course, comes adaptability, flexibility, to be able to adapt to changing environments, which is what we were talking about before. In a way, the more people will be able to adapt to crisis and change, the more resilient they'll be, the better they'll be able to, minimize the harm to themselves and to others. And so it's an important set of skills. It's beyond the treatment of disorder. It's really about the development of skills that may be very helpful across communities, across the world. And there's some lovely work. I've got I supervise someone called Hen Saab, who's a Muslim clinical psychologist who's just developed a whole set of mindfulness programs across about 18 languages, and is providing those in the sort of Sydney region. Some wonderful mindfulness resources, and she's reaching out with some of these programs and finding that people are very welcoming of some of these post-COVID, where people seemed, there was a lot of fear and a lot of anxiety. I think there still is. It's not just disappeared. So there are people out there, really bringing this into the population and doing some wonderful things, and hopefully preparing us for what's ahead. I don't want to sound too gloomy because we don't know what's ahead, but I think we can anticipate that there'll be some troubles along the way.
Well, it's interesting to listen to the importance and the value of a general sense of groundedness, that equanimity, really exploring the space of finding calm and composure in what can be a confusing time. And for a lot of us, we're completely inundated with so much information that alone is difficult to sort out. And we're trying to get to the bottom of something or to the truth of something. We're trying to cling to a single point rather than maybe being grounded in that there is movement, and the importance is that adaptability, rather than finding rather than finding the truth or the point, because we're still trying to go back to fusion, grabbing the thing that makes sense versus, maybe it's a process that we can kind of look at. And yes, there are some challenges that the human race is facing, and in many ways, we've faced them many a time previously, and this just appears to be new and different, which it is. But we've also got lots of new and interesting technologies, and we're trying to do it at a global sense for the first time. I think the fact that there are global organizations is new in history. That lots of countries are involved in. So it's fascinating to be in this part of history, to observe what has happened in the past. Not that I was there, but to hear about it and read about it, and to look at where are we today, and how we do this as a collective, category called humans.
Yeah, and I think more and more there's a need for human beings to be connected to one another. And so COVID, of course, has been very difficult for people. It's disconnected people further. So I think, I hope that there's move towards bringing people together with, legitimate and healthy ways of connecting, that are going to be very valuable in the future for us to connect in so many ways that there's a call for that. And certainly I think that will be a very interesting area, because there's a sort of an additional surge of loneliness and disconnection on top of all the other problems. And so people can be very isolated. We've always known that people can be very isolated, but I think even more so now. So it's very important to find ways of connecting and so on. But the other thing I suppose is interesting is that of course, from a sort of Buddhist perspective and therefore translated through mindfulness programs, is the idea, of course, that suffering exists, but that we make our own suffering because of our own perception of what happens. So the second arrow, so if I have pain, yes, I have pain, but the second arrow is my thoughts and fears and perception of the pain. So we can't necessarily change our circumstances, our health, a crisis in the world, whatever it might be. We can make attempts to do that, and that's absolutely right. But we can't always change things. But we can certainly do some work on our own inner world, which creates so much of the problems associated with what's actually happening to us. And we see it every day with our clients. They can be in a very comfortable position and secure position in life, seemingly, and yet be tortured mentally. And other people can be in a very tricky situation and manage it well and seem relatively happy. So we know that it's not relative. Our perception is that we can find things outside of ourselves to make us happy or to provide well-being. But of course, the inside, our thoughts and perceptions and our relationship to our thoughts is also very important. And that's where we can also, as psychologists, be immensely helpful, because the answer is not outside. It's not in the drinking. It's not in the stealing. It's not in the fighting. It's not in the arguing. It's not in the, all of the things that we might do to get what we think is the solution. The solution is within, and that's where, so a focus on the inner world, I think, is also really important. And of course, all the work in mindfulness is about, in a way, uncovering. I like the idea that it's uncovering the invisible puppet master, the body, the thing that makes us react, that makes us reach for the whiskey or shout at their partner or whatever that reaction is. Once we uncover that using mindfulness techniques of practicing, scanning the body, becoming aware of the subtlety of what's happening in the body and its relationship to the mind, those co-emerging elements of thoughts and the co-emergent feeling in the body and vice versa. Once we uncover that, we start to, it's like revealing this puppet master that we didn't know was there, that was making us do all these things. Now I can decide whether I respond to that feeling of tightness in my chest that I might call fear, or the heat in my cheeks that I might call anger. I can now recognize it. I've sat with it. I've learned equanimity. I can feel it, observe it, but not react to it. So now I have a choice about how I behave in response to those things. I can make some wise decisions. It still might be to leave the room or to do something, but it would be a decision that I make rather than just reacting, being controlled in a way by what's unseen. So bringing awareness, the process of bringing awareness of these inner sensations that create a desire for more or a wishing to get rid of it. Once we know those, then we can learn to abide with them. And the phrase that Bruno uses, which I love, is that the practice of mindfulness teaches us or gives us a skill at becoming unperturbed by the experiences within the framework of the mind and body. And I just love that, to be able to be unperturbed, to be aware of them, all that's going on with every thought. There's a co-emergent sensation and vice versa, and a memory pops up and there's a sensation, but to be aware of them, but to be unperturbed by them, such that we can then make decisions about what we want to do and how we want to behave and what we believe is right according to our values, rather than this reactive world. And when my students undertake the mindfulness training, they often say, God, I can see now my clients reacting. I can imagine what they must be feeling, and I can see that they're reacting to these things. And that shows a great wisdom. It's like seeing this other layer underneath what we're normally aware of, this deeper layer of understanding that each of those little thoughts that come up, pop, 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 about what this means to me, will give rise to a co-emergent sensation, no matter how subtle. Sometimes they're very strong, sometimes they're subtle, but a lot of them are under our threshold of awareness, so we're not normally aware of them. So I might move my foot without even knowing because it's, there's pain in my toe or something. Equally, someone says something to me and I don't realize that I'm actually feeling tight and heat, but I will want to get rid of that. And so that's when I shout, and release it. And so being aware of the tightness and the tension and knowing it gives me a choice whether I shout or whether I don't shout. I still may choose to shout, but it's a choice. And so I think that's one of the really important skills that doesn't often get talked about in mindfulness. There's lots of a kind of lay idea of being in the moment and so on, and there's lots of other aspects to it that are very important. But to become unperturbed gives us a tremendous freedom, such that even when things are difficult outside and we're experiencing some co-emergent, discomfort, we don't need to do anything with that. It's just sensations. They are just sensations. And so, and that's where it brings me into kind of working with pain, where I've been doing quite a lot of research in trying to utilize some of the techniques that are used in practicing meditation, because in traditional meditation, you sit for very long times. And even in the Vipassana training, which I've done a few times, you sit for 10 hours a day for 10 days, cross-legged on not a very thick mat. And there's pain. And so one's sitting and learning to experience strong sensations, but with no reaction. And that skill is very helpful and generalizes out to other areas. But what we were looking at was there are some techniques within the practice that just observing the sensations objectively as just sensations, trying to not have that second arrow come in, just a sensation, it's just movement or heaviness, lightness, objective sensations. And that seems to be, and in practice, when one needs to sit quietly with pain, these are techniques that are very helpful in just abiding, to be unperturbed by those experiences. So we've been looking at ways that we could just use those very brief techniques with people with chronic pain. And there's a few studies sort of building with acute pain. We used one with students who had to put their hand into a very, very, very cold, ice cold bath to induce pain. And we also work with some people with chronic pain. And the method is only about 30 seconds twice. So it's about a minute. It's a very brief intervention. We weren't expecting huge findings, although the initial study did show a reduction in the perception of pain and distress associated with pain. And subsequent studies with students with acute pain, and what it showed is that they could keep their hand in the water for much longer. So they tolerated the pain for longer, having had the instructions in observing the sensations objectively rather than a distraction technique. And then with people with chronic pain, there was also...
And sorry to jump in, Alice.
Yeah.
And while they've got their hand in the bucket of water, they are objectively describing the pain. So, for example,
not while they're doing it, they're applying that technique. So they get instruction prior to so here's what you're going to do when you get in you, and then they put their hand in this very ice cold tank with a maximum of 2 minutes, because we don't want them to hurt themselves.
Sure.
But what I could see was that it was interesting that some people that were applying that technique, and a lot of young people kept their arm in for the whole 2 minutes. And over the two groups, the distraction group, who were applying distracting, trying not to feel the sensations, the group who were objectively, deliberately observing the sensations, were able to stay longer. And they also recognized the sensations as being pain. That's sort of what we call the threshold. a little bit later. So they were labeling it as pain a little bit later as a result. So these are small changes, but it's only a minute instruction. You know, it was very brief instruction. And it seemed to alter their experience. And with people with chronic pain, we've had mixed results. One study we got fantastic results. The second study, it was people who with much more chronic pain, and the results were a bit less. But there were still some findings in relation to, again, this ability to manage or their perception of the pain and the distress associated with the pain. So some small results. So we've been looking at that. We're looking at another study now doing the same thing but online, so that people can just do it via Zoom, get the instructions, apply it on a regular basis with chronic pain, and then we look at what that looks like after 2 weeks, and then again after 6 months, and see whether this is, if you like, a technique that could be implemented irrespective of whether the person is doing a full mindfulness training. It could be part or an adjunct to CBT or any other method at just being able to learn the skill of being aware of sensations, but without judgment, really looking at them for what they really are, the true nature of the experience, which is simply solid versus sort of more fluid, hot or cold, heavy or light, moving or still, or somewhere across those spectrums. And so when you think of something as heavy or light, neither is better. And the same with hot or cold. If something's very cold or very hot, it might be unpleasant, but usually if it's less intense, it's going to be a bit more easy to manage. And what we see is there's a change from the extremes towards the center when people are managing to develop the skills. So we're looking at some interesting ways of trying to assess the change. We've also developed an equanimity scale to try and capture the change, because there's lots of mindfulness scales that measure mindfulness, but to measure a change in this component of mindfulness, this outcome of equanimity or equipoise or non-reactivity, and try to encapsulate that. And we're trying that out with clients to see whether we're really actually affecting that with mindfulness programs. So there's some interesting, psychologists, they're always developing scales, aren't they? There's so many scales. There's something like 45 mindfulness measures now. But I think this one could be helpful.
It is such a fascinating part of the mindfulness and acceptance space of how we relate to these experiences and the language that we put on them. There's certainly a significant amount to say about the relationship we have with sensations and whether they are unwanted sensations or they're wanted sensations versus they're good or bad. And because we have this kind of relational frame of getting away from what is bad and wanting more of good versus wanted and unwanted. They're much more described as things that at least pose a question of do you like it or dislike it, and so therefore you've got a relationship to it.
Yes.
And
neutral, of course, sensations that are neutral are often perceived as slightly unpleasant because they're kind of not positively rewarding, and so we don't like neutral. What we seek is sensations that are pleasant, but what we're slightly skewed towards is picking up and recognizing sensations that are negative or unpleasant. So there's a sort of skew that something has to be like 0.6 pleasant to actually become aware of, as opposed to a 0.4 unpleasant. So we pick up on, and that's probably for survival reasons. It doesn't serve much purpose to be able to feel, recognize that we have a pleasant sensation, whereas the unpleasant ones, it probably is beneficial to us to be able to bring those to awareness a little bit quicker. And so, but a lot of the neutral ones and the subtle ones are often go, unnoticed. And there's a lot of research also on interoception, the ability to perceive sensations within the body. And some of the research is coming out to suggest that, for example, in depression, people have a lower interoceptive ability, and that they can't feel the body. And it may be Norm Farb is doing some research where he put depressed people in a scanning machine and showed them depressing images, and the brain kind of shut off parts of the somatosensory cortex that such that they wouldn't be feeling the experience of sadness, almost trying to protect. It was as if they was trying to protect them. But of course, what that does is mean that they become less aware of sensations in the body. And therefore, they're reacting to that invisible puppet master even more because there's less awareness. And so there's also some evidence that interoceptive awareness is lower across a number of different disorders as well, and that therefore we could hypothesize that by increasing interoceptive ability, by learning to feel the body, we might well actually get the reverse and actually increase well-being. And that seems to be showing, in some of the research that people who can feel more of the body, and I don't mean feel just their breath and they worry about their breath, it's not just a specific area of the body. Like if you've got chronic pain, you might be very aware of your knee because it's causing pain, but you may not be aware of much else in the body. And when we work with clients with MICBC, we get them to fill in literally the squares of a body, 100 squares, like a little map of the body, and fill in where they can feel any sensation. And after their first body scan, after one of these meditation techniques where we start to feel the body, and often they can feel only maybe small bits, the fingers, the toes, maybe a little bit of pain in the left knee or something like that. So maybe even less than 10% of the body is in awareness. After a few sessions, they come back, fill it in weekly. You see this change, and in a few weeks, some clients can fill in the whole body, so they're now able to feel sensation throughout the body. And when we move into the really more advanced meditations, they actually practice through the body, so not just the surface but the inside as well, so to feel everything within the body. And of course, over practice, feeling it quicker. At first we have to go slowly, then we can go quicker, so that we can check in with the whole body from moment to moment, to be aware of what's happening between the mind and the body. And then we've got these tremendous skills, not just in equanimity, because we've learned to feel it but not react, but also early cue detection, because if we can feel the subtle sensations throughout the body, it means that, if I'm feeling unsettled about something, I can pick that up earlier than perhaps if I only feel my fingers and toes. If I start to feel angry, I'm not going to feel or be aware of anger until it's really up here, and it's too late. I'm going to react. So it's early cue detection, and there's some evidence that people seem in higher interoceptive ability correlated with making better decisions as well. And I can see why, because we're going to be able to actually feel and be aware of how we feel about that. And rather than simply reacting to one of these thoughts that arise, So it's a lovely area to be thinking about going forward.
It makes so much sense when I think about learned helplessness, in that if you're in a situation or a context in which you feel there is no escape, there's probably some protective function there to have low interoception capacity at that time to protect, to dull your senses. Sadly, though, when you're in the modern world and your interoception capacity is low, it removes the impetus for action, for some behavioral activation, and that's an important part of someone changing their context. So I can see how someone who has high interoception might be cued earlier to say, I can avoid problems or I can do something about it. I'm more connected with my value set and my motivations. I've got maybe some a greater locus of control because of that. It's all sort of piecing together so well.
And of course, if you have low interoceptive ability because of depression or because of chronic pain or other things, although it might be protective in that you're not feeling, perhaps in theory, as much distress, although I suspect in chronic pain you still feel probably just as much pain, but what's happening is you can't feel as much. Of course, you also can't feel some of the pleasant sensations. So joy and happiness and contentment would be below the threshold of awareness. And so it's no wonder that then pleasure, which is we're not that sensitive to anyway, but it's no wonder that those sensations are not available. And so the increase in interoceptive awareness, as well as being aware of all of the unpleasant sensations, which we tend to stress because we're trying to develop equanimity to them. But equally, we have to develop equanimity in relation to the pleasant sensations, craving. So if I just simply, this part of the body feels nice, I'll just stay here. That's attachment. And then all I'm doing is just staying with a nice area of the body. It feels nice. It's all lovely, wonderful, but it's not going to give me the skill of detaching, learning equanimity to whatever arises in our, our awareness, whether it's unpleasant or pleasant. We treat it the same, just no reaction, keep moving, no reaction, keep moving through the body. So we want to be able to feel the whole range, unpleasant to pleasant, to be fully aware, to be able to utilize sensations to drive our decisions and our wisdom, because it's in relation to our mind. It's not, they're connected. It's like I always sort of, say to students, that we've almost acted as if this is the world for psychology to focus on, this part here, and anything below there, don't bother. And of course, they're so interconnected, and there's a lovely fluidity between every thought gives rise to a sensation. Every sensation will produce more thoughts. And so
I love your term of co-emerging. That's a beautiful way of describing what they do.
Yeah.
And that they just decay by themselves as well. They just go sort of vanish again. They decay and they no longer exist, at least for a period of time.
Yeah. So that and that's the Buddhist. That's where the Buddhist wisdom comes, because all of this is really Buddhist wisdom that we've colonized, really, in a way. But the Buddhist wisdom is that, of course, impermanence. That everything is impermanent. Every sensation comes and goes. Every thought arises from somewhere and disappears. Everything, every cell in our body passes away, arises, passes away. And of course we arise and pass away, and maybe the world arises and passes away, so everything is in flux. And so it's hard to tell that to someone who's sitting there and they're in pain. Oh, don't worry, it's impermanent, everything's changing. But when they practice and start to experience, this perpetual, like almost like the those, what are they called? Like the octopuses, where they flash different colors across their skin, the squid, they change colors. It's a bit like that. There's just a perpetual relation between thoughts and body, changing. And, I might feel a terrible pain in my elbow on the way down. And when I come back, there's nothing. It's changed. So learning impermanence experientially, I think, is what teaches people.
And it's a real learning, because so much of our world is based on this medical model, which is to remove pain. That when we go to a doctor, the an initial result that we're looking for is, can you stop my elbow, my knee, my back from hurting? And quite often the answer is yes. We can immediately give you some sort of painkiller where it's greater than off the shelf. And so once again, we cling to a result of control, And sadly, there are permanent structural um, damage that occurs in accidents, and obviously our body's decaying. That means that these are going to be, permanent injuries. And this is where we have that chronic and severe pain example. And it requires something more than just medical intervention. It requires both, where we can potentially alleviate some with drugs, with potentially, surgery if someone chooses to, or other means. But then there's also other things like, we know that physios these days are extremely well versed in saying, walk with the pain. You need to move your arm more to experience less, but that also means functionality and maybe development of improved self-identity and so on. But it's living with pain versus, it always hurts me to hear things like, pain management. It's almost like you can just manage it, it goes away. There's almost like unintended meaning that comes from that, or anger management, rather than saying, well, no, you will have anger for your entire life. There's a function and a reason for that, but the question is, what's the choice behind that? So it's lovely to hear you describing working with pain in an elegant and respectful way.
It's definitely an area. It's an area, particularly in the US, where the medicine itself has become a huge problem,
Yes.
and so we have to explore other ways of managing the physical distress that people experience. And of course, you're right. The second arrow is the resentment of pain. So, when we work with clients, we try and get them to take a more curious or even a welcoming attitude to the sensations, that they're not, in a way, not identifying them as me, but seeing them as a sensation, as an experience, and trying to find a different relationship to them. Now, it's very hard because pain is, and chronic pain is very, very difficult. But people have been shown to be able to make some inroads. So we need to come at it from all angles, really. And it might be with, just, I was very curious about pain, and so I was also curious about some of the other areas like yoga, because I thought that might be useful. I did my yoga teacher training to try and be able to think of ways to combine, and I found out quite a lot. I mean, there are so many meeting places between Buddhist mindfulness and the yogic teachings as well. The idea of the subtle body in yoga, not just the muscles, but some of the subtler experiences within the body. Or it has, kind of makes sense from within the literature in interoceptive ability. And we did one study which was to look at interoceptive, what happens interoceptively with people undertaking yoga for trauma. And as well as, so these participants, as well as getting some benefit from doing yoga designed for trauma in terms of their well-being, also that correlated with higher interoceptive ability. So when we teach yoga in a mindful way, then it's really like a moving meditation. One's not just moving the arm, oh, I better do that, I better do that. The arm, we're moving our arm whilst feeling the arm. So one's actually moving the body, getting some movement, some ability, to keep the body, active, but doing it mindfully, so that we're also learning interoceptive ability and learning some wisdom about what movements are really unhelpful and what movements are okay, even if there's some discomfort, so that we can actually learn the wisdom by actually being aware of the subtle sensations in the body. Doing a yoga class while you're very low on interoceptive ability would be very difficult and possibly a bit dangerous, because you're going to push yourself further and not really be aware of it. So we can use this body wisdom, I think, in other ways. And it's difficult because yoga, there's a lot of variation in yoga teaching and lots of different styles, and
Sure.
and some may be less helpful than others for people with pain or distress. but I certainly think it's an interesting area to teach basically moving meditation that enables us to get some fitness, some well-being physically as well as mentally, and learn some equanimity and some interoceptive ability as well.
It seems to me like that any of these practices have a moderating feature of making space and allowing for there to be pain or discomfort. And even if that discomfort is, this exercise is boring, the fact that someone might sit in boredom, which might be a lower level of discomfort, is still so valuable, because many of us have lost even the capacity of sitting with boredom. We pick up our phones, we don't like looking out, the window anymore and appreciating nature. We're looking for a distraction model to the neutral stimulus. That has now become, a new pain.
Yes, and I think you're absolutely right that boredom is really a mild agitation in the body. It's mildly unpleasant, and therefore we want to find something stimulating to take our attention away from that mild agitation, or which might be because of sort of mild levels of worry and so on. So we're looking for stimulation in a way to not feel. And of course, as screens are now part of our lives, we're almost perpetually on screens, we're perpetually being stimulated, that the intolerance of our own experience, our own mind and body experience internally, I think is growing. And, I've seen with young people when there's even students that I work with and ask them to train and do some meditation practice, they find it very difficult to let go of their phones, to switch their phones off. I mean, they just, it seems amazing to me, but I'm the different generation. But to let go of the phone and to be able to just abide with themselves for a period of time is very, very, very difficult. And these are pretty well people generally. They're not the distressed people, but they find it incredibly difficult, either because there's some really strong fear and aversion, or just this mild, as you say, this mild agitation of not enough stimulation, and therefore it's perceived as, or it's they're not necessarily aware of it, but it leads to a mild agitation. So I think boredom is a huge challenge. One of the lovely things about doing regular meditation and exposing to boredom is that one really never feels bored again.
Yeah.
But that again takes considerable practice.
There's something I think to say about this space in terms of how we do therapy. The fact that as clinicians we can try and gauge what our clients need, and any level of practice, it's the practice of being the observer, the noticer, being grounded, and coming from a place of equanimity to either appreciate what's around you so that the boredom isn't there, or create a space where you can expose, so to speak, to boredom, or to the acceptance of real life. There's so many ways. We don't have to start with something very significant like half an hour of sitting meditation or walking meditation. The fact that we're actually able to do this in any context, even the practice of gently being lighthearted with oneself can be a lovely practice of being vulnerable, of making space for some shortcomings, maybe detaching from those shortcomings and seeing that we're humans, so we don't have to carry that label, and so on. There's an infinite number of ways that we can do this. And so conversations like this just are so heartening to hear with someone with your experience, because it tells me a lot about what we can as clinicians and as humans, in our other roles as parents, as siblings and friends and colleagues and the like, that we can live life differently and support, those around us in very simple and practical ways without necessarily labeling as therapy or with a term. It's a process and a practice of being in this world in a more flexible way.
Indeed. I guess I'd add a postscript to that, which is that I can really recommend people engage in practice. So,
absolutely.
MICBT is half an hour twice a day, and that's quite for over about 10 weeks. It's quite a commitment. But often those that commit to it are those that are suffering the most. So they've got more to gain in a way. And so I've learned not to underestimate anyone, and find that sometimes people will really do a tremendous amount of work and make life-changing changes and do wonderfully. But it's not for everyone, and not everyone can do that practice. And the same with the extended retreats, silent retreats, which are very challenging but are a shortcut, a quick, powerful dose, if you like.
And Alice, I can attest to that. I'm not someone who's done many repeats or anything like that. I've done a single Vipassana retreat, 12 days, and I can very clearly say how much positive change and efficacy it's had in my life, because it's given me real world experience. And I'm someone that once I feel something, once I experience something, I get it. And that's probably because I'm human. And so once you've got it, that's never going to leave me. Yes, it could be improved and it could be reinforced and become more robust. But, I've got those skills forever because I've done them once, but that intensity is great. So yeah, likewise, to our listeners, I would definitely say whether it's an MICBT, or going to your local meditation center or a Vipassana retreat.
Yes, and Vipassana retreats might be a bit challenging for some of the clients that we work with.
Sure.
I think they would. And in a way, I think that was Bruno's motivation to develop MICBT, which the components of which, of course, you would recognize from the Vipassana and the Theravada tradition. But in a way, MICBT is designed for those people that wouldn't be able to, for various reasons, take on those more intense retreats, which are definitely a very powerful way of upskilling fast. But over instead of 10 days, it's 10 weeks really, and a less intense. But it probably adds up to almost the same amount of practice. But it's about 100 hours of practice. So it's a way of making it possible for people who are more vulnerable, with a skilled therapist who can then also manage any of the issues that arise, because there's been a lot of press recently about the unwanted or aversive experiences within practice. But of course, there are unwanted and aversive experiences within any therapy. Within CBT, it's unpleasant to be thinking about the thoughts. There's distress. We deliberately, in exposure work, we deliberately bring about distress. So there are many transient experiences in any form of therapy, I would argue. If they're more than transient, then that's something that the therapist would need to be able to work with, and the therapist needs to be able to work with even the transient ones to make sure the client is aware of how to manage them so they don't become any more than that. But it's provided it's done within that safe environment, either of a traditional setting or with a therapist, if they're doing intense therapy, MICBT type programs, then it's safe. And I suppose the other thing I'd also just add is that I think we know mindfulness has become tremendously corporatized and commercialized and all of that, the mindfulness. And I think there's often a confusion between relaxation and mindfulness practice. So I've seen a couple of places where they charge people a great deal of money to sit in a very, very comfortable, beautiful designer chair with some soft music. And I'm sure it's a wonderfully relaxing experience, and would send most people to sleep, if not all. But it's not mindfulness, but it is relaxation. So I think for the public, if I'm distressed and I want to try and use mindfulness, if I go and have a nice sleep in a comfy chair, it'll be blissful and pleasant, but it won't make any difference once I wake up. I haven't changed my relationship to my thoughts, and therefore it's not the optimum help. And I think those confusions, I hope, over the years kind of iron out a bit, so we're a bit clearer on what's a change-based focused therapy, the utilization of mindfulness in that with a relaxation. And there's lots of things in between where they do hold components of being present and some of these really valuable components that are very useful. But I think there's always a risk with everything that's good that it'll be overused somewhat. So I sometimes feel a bit protective. My attachment to mindfulness means that I get a bit overprotective.
And thank you for making that distinction, because it is an important one. I think part of our job as clinicians and psychologists is to educate the community about what mindfulness actually is, and it's certainly not the practice of relaxation. And it doesn't mean that relaxation isn't useful and shouldn't be practiced. I think that's lovely to do, but it's not really targeted at changing your relationship with thoughts, changing your relationship with sensations and the like. But sadly, I am mindful of our time. So
yes, indeed.
Before I let you go, can I ask you whether there are any resources or places that our listeners can go to, or books they might start with, in terms of reading, if they would like to follow up on our topic today? Anything that you have as a starting point, or texts or journals? Where can we begin?
Well, certainly for MICBT, which is one of several different programs, the website, which I think is mindfulness.net. But if you Google MICBT, it comes up first on the list. And that's the website.
mindfulness.net.au.
Beautiful, thank you. And there's quite a lot of information. And they're one of Bruno's books. We've written a clinician's guidebook recently, which is myself and Bruno and my colleague Sally, which is designed for clinicians to use when they're providing MICBT with clients. But there is a smaller light blue book, which is a self-help book, which is designed for people who wish to read about the program and go through, and to apply it themselves. So it won't suit everyone, but I sometimes give it to clients while we're going through the program so they can do their own reading. So, and it does give an overview of the theory of the co-emergent model, and it gives an overview within the context of the original sort of teachings from which it's come. So it's kind of respectfully set in that context. There are lots and lots and lots of papers. I can certainly send you some links for a few that I think that would be really good introductions. And there are some beautiful mindfulness books. I just think beware the more corporatized versions. I would guide people towards mindfulness that has at least a base in some of the traditional teaching, or written by someone who has a knowledge of the traditional teaching from which they're drawing, so that it doesn't lose some of the really important parts of the teaching.
That's a wonderful starting points, and I think there's so many places that we can further this discussion in, and you and I could talk for forget hours. I think days or weeks, but sadly it's got to come to an end. But I really thank you for your time and your research and your contributions as well. And the importance of giving rise to mindfulness and its value, because it's for me, it's in the heart of not only therapy, it's in the heart of human beings. It's a way of living, and hence why many of us in this space, it becomes part of who we are, and how we view the world, and that's not from a position of superiority, but one of saying it's liberating, and it allows us to live more comfortably and reduce our own suffering. And so I think there's great power and value in that. So I appreciate you immensely, Alice, and thank you very much. And
Thank you. It's an
I'll have to have
absolute
you back
pleasure.
on the show at some point.
Best wishes. Cheers.
If you enjoyed this podcast, please support it by going to iTunes and putting a review. Subscribe, share it via social media, and tell others about it. Start a conversation. It's listeners like you that make this able and possible, and why we bring in these guests to go out and share their knowledge and resources. And just lastly, if you are a psychologist and you want to go out and be part of a bigger team, develop your experience and get into some exciting work, come to strategicpsychology.com.au/careers and reach out. I'd love to hear from you.